Centers of Excellence intend to do really two things. Better initiate people into treatment, make sure that we're getting folks who need treatment into treatment, and number two, making sure that they stay engaged and retained in the continuum of care, because we know length of stay in the continuum of care is directly correlated to recovery from the disease of addiction. So initiation and engagement and retention in treatment. We're going to do that really three ways. Number one, the Centers of Excellence will treat the whole person. Certainly we're going to treat the addiction, but we know that there are, for many, physical and mental health issues that are underlying or driving the addiction. And so we want to be sure that we're not only treating that addiction, but that we're treating the underlying causes of it. We're going to do that, secondly, through a community-based care management team. The majority of the funding that the centers have received is to hire community-based care managers. These folks will ensure that people needing treatment get into treatment, get the appropriate level of care as quickly as they can, that they're supported through the continuum of care as they move from level to level of care. We'll also ensure that these folks get to the physical health services they need as well as the mental health services, and at the appropriate time ensure that they get access to other social supports, employment, housing, things like that. And thirdly, we're going to better initiate and keep people in treatment by expanding access to medication-assisted treatment when appropriate. We know the evidence shows that FDA-approved medications to treat addiction, buprenorphine, methadone, and naltrexone, can keep people engaged in the continuum of care. And again, we know that length of stay in the continuum of care is directly correlated to recovery from the disease.